Our source lays out the typical timing and symptoms.
Let's start with that first phase, the hyperthyroid one. When does that usually hit?
That tends to be pretty early postpartum, usually somewhere between 1 and 4 months after delivery.
And what might someone notice? What are the symptoms?
Things like feeling really fatigued, although, confusingly, fatigue can happen in both phases.
Oh, great.
Yeah, tricky one. Also, maybe heart palpitations, like your heart is racing or fluttering. Losing weight without trying, feeling unusually hot or sweaty, anxiety, maybe even hand tremors.
Okay, but hang on. Fatigue, anxiety, feeling hot and bothered. That sounds an awful lot like just having a newborn.
Exactly. That's the really challenging part.
Yeah.
They overlap with normal postpartum experiences. The stress, the sleep deprivation is huge.
So it could easily be missed.
Very easily. Or just dismissed as, oh, you're just tired, you just had a baby. That's why awareness is so key.
What happens after that?
Well, frequently, the woman then transitions into the hypothyroid phase. This usually happens a bit later, maybe around 4 to 8 months postpartum.
And the symptoms flip.
Pretty much. Now you're looking at symptoms of too little thyroid hormone, so fatigue, again, the ever-present fatigue.
Of course.
But also things like gaining weight, feeling depressed or down, really dry skin, feeling cold when others aren't, constipation.
And again,
This generally happens within, say, 12 to 18 months after the baby was born.
and is there good news here?
Yes, mostly good news. Our source material says the majority of women, something like 70 to 80%, they do get back to normal thyroid function. The thyroid heals itself.
Okay, 70–80% recovery. That's pretty reassuring. Is there a but?
There is a significant but. For the remaining 20 to 30%, unfortunately, the hypothyroidism becomes permanent. Their thyroid just doesn't fully recover.
Oh,